My name is Waisiki Lomalangi. I'm the radiographer in charge here at the Rarotonga Hospital. I was here in 2008 and I've been working here for almost 12 years. And I've always have a passion of getting diagnostic images in order to help doctors provide help to sick people. I'll be responsible for providing a service for CT scans once it's installed later in the year. So far, everything has progressed well. We are looking at hopefully by the end of November to have this machine installed, and then there'll be 2 weeks of training before we finally receive patients to start providing a service for this machine. One of the biggest benefits of having this machine is cost. We have quite a burden for the government of sending most of our sick patients across to just have this simple x-ray to be done on them. And with this machine in the country, we would cut the number of people going across just to have this done. Secondly, in terms of diagnostic, it provides the doctors with another level of imaging that would benefit them in a sense of providing better care and better management of patients. And finally, I believe it would be accessible to people. Only the fortunate ones are the ones who get the referral to get this service in New Zealand, but once it's in our country, anyone can access it.